If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. It's free. There's creation tools that allow you to record and edit your podcast right from your phone or your computer. Anchor will distribute your podcast for you. It can be heard on Spotify, Apple Podcasts, and many, many more. You can make money from your podcast with no minimum listenership. Everything you need to make a podcast in one place. Download the Anchor app today. Go to anchor.fm to get started. That's anchor.fm to get started today. This is Shockwave News Live, Shockwave News reporting. I want to turn to the news just a second. The news source on the main headline is Coronavirus Criminals. The CDC deliberately released an infected patient in the San Antonio area while positioning itself to financially benefit from the exploding epidemic known as the coronavirus. And this source is from naturalnews.com. That's where I'm pulling this headline news, naturalnews.com. The CDC just deliberately released an infected patient in the San Antonio, Texas area. The number of accidental releases of infected patients, the nearly 4-week withholding of diagnostic test kits, and the downplaying of the severity of the outbreak can no longer be explained away as a coincidence. So think about that, folks. Even the CDC is rotten to the core. The CDC has the best testing, lab, and facilities in the entire world. They can contain the worst of the worst and the best of the best viruses, different types of test viruses, all different types of molecules, harmful, influenza, SARS, you name it now, the coronavirus, they can handle it all in the CDC. But the CDC knows that. The CDC has sold their soul. Don't shit you 1 minute. The CDC is as crooked as all get out. They're as crooked as a place, even though they're the best of the best in the world. They're as crooked as we know. They're in bed with the pharmaceutical companies who want nothing more than to profit off of your sickness and to profit, of course, off your death. They don't care. I'm not making this crap up. This is the truth. This is the absolute truth. So I'm going to continue reading the article here. This appears to be deliberate, a planned strategy to spread the coronavirus across the America, because nationwide chaos can get more funding and medical martial law powers for the CDC itself. So think about that. I'll stop right there for just a second as I continue on reading here in a minute. In a medical emergency, should it be an outbreak, in this case of anything, whether it be the flu, in this case coronavirus, here's how things kind of go down. Martial law can be declared. The CDC will take over. The CDC will take over, meaning they have control and they're calling the shots. The president can jump up and down, but in a medical martial law situation, the CDC can dispatch the reservists, and they can dispatch the military to help quarantine people when they don't listen. So the CDC has an infinite amount of power. A lot of people don't know that. The CDC is a very powerful organization, but this only comes in time of a major outbreak or plague or something like that, or in this case a pandemic or epidemic, either one. The CDC is in charge. The president can jump up and down, but basically to some degree the president's hands are even tied, because once it becomes, again, a medical martial law, and that's declared, the CDC takes over. So they can lock down, throw you in a cage, and shut you up. That's what they can do, or quarantine you to your home, and you can't leave for X amount of days. Maybe it be 30, 60, 90 days, whatever they deem necessary. A lot of people don't realize just how powerful the CDC is. So the Centers for Disease Control, the CDC, released a patient from isolation in San Antonio, Texas. 2 tests were returned negative for the new coronavirus,
but the person later on tested positive. So the CDC messed up again, failing to make sure the person was truly cleared of the coronavirus before releasing him to the public. The CDC later attempted to cover this catastrophe or this catastrophic error by saying the following. The patient's release results of a subsequent sample were received and determined to be weakly positive out of an abundance of caution. The CDC decided to bring the individual back into isolation at the local medical facility. That's it, period, end of story. Well, bottom line is the CDC fucked up. They're in bed again with the pharmaceutical companies. The pharmaceutical companies around the world are in bed, just like anything else, with the healthcare system in this country and many other countries all around the world. The WHO is just like the mafia. The WHO will condemn the United States for not taking in people from China and all over that are infected, but they'll praise China. I've even seen and heard stories that people that weren't even dead in China, for the love of God, still moving around, but very much infected with the coronavirus. They're putting them in a body bag and throwing them in the oven. In other words, they're cremating them alive in China. So don't sit there and don't tell me these pompous ass, arrogant people that work for the WHO and the CDC. Again, they're all working together for the profit and to make sure that enough people die so that they can get enough funding to keep their little global scams going. This is all part of a deal. This was all organized, this whole entire thing. The CDC knows better. They know disease control better than any organization in the friggin' world here, and yet they're making these simple mistakes by releasing somebody they know with this strain of coronavirus or COVID-19. Oh, let's have COVID-19. It sounds good on social media because coronavirus sounds scary. So let's rename it to COVID-19 now. That's exactly what the WHO has done. So they're taking this disease. They're profiting off of these poor people, everybody that's dying with these diseases, to get more and more and more research money and so on and so forth. So the CDC messed up again by clearing somebody that was not cleared. They cleared them too early. And how do you tell the public? Well, they were weakly you're either positive or you're not. Okay, I had science way back in high school. You're either, when you're testing something, it's either positive or negative. There's no, well, sort of, kind of, looks like it is, or maybe it's not, or yeah, just a little bit is. There is none of that. You're either positive or not. So they released somebody and they fucked up. They released somebody that was positive back into San Antonio, Texas. That's what it looks like. Now the CDC is later attempted to cover this catastrophic story by following the patient's release results of a subsequent sample that they received again that was weakly positive. What a pathetic story. The CDC is now trying to use transgender-like language to describe the virus test results. For starters, a virology point of view, there's no such thing as weakly positive. We all know that. What the excuse my language, what the hell is weakly positive? In the science community, it's pathetic. Let me know what you think. This is Shockwave News reporting live.